Hi, everybody. My name is Noel O'Neill. I'm a director of the Ayurveda Centre, and I just want to briefly tell you about a very important webinar we have coming up on Wednesday, the 2nd of October at 7:30 in the evening. It'll be done online on Zoom, and it's a webinar all about anxiety. So anxiety is something that's very, very prevalent in society nowadays. Actually, it was a couple of people asked me to do this webinar. We do lots of webinars, but a TM teacher asked me because she's seen so many young people with anxiety, and there's an awful lot that Ayurveda can bring to anxiety. So we're going to have two great speakers on the night to talk about the Ayurvedic perspective on anxiety. One is Dr. Don Brennan. Dr. Don Brennan is a medical doctor, but more importantly, he's been practicing Ayurveda now for about 40 years. So, Don, maybe you'll just say a few words about what we can expect to hear next on the Wednesday, the 2nd of October.
Well, no, the seminar is about anxiety, and anxiety is generally a feeling of fear, dread, uneasiness. It does have a purpose for us because it boosts our energy and helps us to focus. And so if you're walking down a dark avenue in the middle of the night and you hear a sound, you're a little bit anxious, a normal, healthy response. But there are anxiety disorders where the anxiety interferes with the ability to function, where the reactions can be out of proportion to the situation, where you can't even control your response to the situation. And it comes with pretty nasty symptoms, which are anxious thoughts, hard to control, being tense, irritable, restless, with difficulty concentrating, and then physical symptoms, the pounding of the heart, unexplained aches and pains, dizziness, shortness of breath, or changes in behavior, avoiding some everyday activities, or getting sleep problems. So this can be very problematic, and lots of people nowadays are suffering from this generalized anxiety disorders. Others have panics, others have phobias. And all of this is a real problem because, in truth, why it happens is not clearly known. All sorts of ideas about the genetics, about the environmental factors, about changes in the brain or the biochemistry. But it's not just that it itself is a problem. Anxiety can lead to further problems of, depression, substance abuse, sleeping problems, digestive problems, headaches, isolation, and problems functioning generally, and a very poor quality of life. So it really is a big problem. And when you think of the treatments available, it's psychotherapy or it's drugs. And the drugs are not very effective. The effective drugs like Valium have the possibility of addiction, so they can only be used. So often it comes down to drugs that dull the physical aspects, which feed into the anxiety, or antidepressant treatments. And then there's psychotherapy, cognitive behavior therapy. So it's in that perspective that when we think of a complementary approach, which would be acceptable to the medical, like as a stress management, but when you have an ancient tradition that offers so many strategies which are time-tested and even evidence-based nowadays, I think it becomes really worthwhile listening to Rajvinder and listening to what Vijay Rajvinder has to tell us about the Ayurvedic approach.
Okay, Don, that's great. That's great. A good explanation of anxiety there. So the other speaker on our webinar is going to be Dr. Rajvinder Kaur. Now, Dr. Rajvinder is an Ayurvedic doctor. So in India, to become an Ayurvedic doctor, it's a 6-year degree course followed by a time in hospital and, working in clinical settings, So Dr. Rajvinder is very, very experienced. She's been in Ireland since 2007. She consults with thousands upon thousands of people, and she's very well known. So Dr. Rajvinder, can you tell us a little bit about what you're going to speak about on this particular webinar?
Yes, thank you. In this webinar, we are looking at the Ayurveda perspective over anxiety. What Ayurveda recognizes is anxiety is vata imbalance, the air element imbalance in the physiology. So in the webinar, we are covering the practical tips how to manage the anxiety and how to restore the balance back. So we will be talking about some diet and lifestyle tips, for example, breathing exercise, and then self-massage, use of some of the aroma oils, things like that. And also we will be exploring some of the nerve tonics, herbs like Brahmi and some of the other herbs, how they could help with the anxiety. So it's a very kind of a very good webinar, which give you a lot of practical tips to restore the Vata back into balance. So when Vata is in balance, we feel joyful, we feel full of ideas, imagination, we feel ourselves. When Vata is out of balance, as Dr. Brennan said, we are full of fear, we feel lonely, and our nervous system is out of balance. So yeah, that's what we are exploring in this webinar. Thanks.
Okay, Dr. Rajvinder. Well, it sounds like it's going to be a great webinar. For the new people who aren't familiar with Ayurveda, don't worry about the terms like Vata, Pitta, Kapha. We'll be explaining them all in the night, and we'll be showing you where you can get lots more information. So I'm really looking forward to it. Hopefully it'll be full of practical information for people. I always think what suits one person is not necessarily what works or suits another person. So we'll be giving lots of tips in this webinar that people can try. We don't make any promises to anybody, but we do give you an understanding from an Ayurvedic perspective and some things that you can do that can hopefully help to begin to redress your anxiety, So it's on Wednesday, the 2nd of October at 7:30. However, it's online on Zoom, but we're going to need to get your email address in order for you to register for it. So just use the link in this post. You can see a MailChimp link there where you can register with your email address and your first name, and we'll send you a link to the webinar, and you can join us on Wednesday, the 2nd of October. So that's fantastic. So we look forward to seeing everybody. So thanks very much, doctors. Thank you.